Hey guys, it's Heidi again, coming at you from home. This week I wanted to talk to you guys about persistent pulmonary hypertension of the newborn and interventricular hemorrhages. So let's just go ahead and get started. I hope everybody's doing okay, staying safe, and we'll get you guys through this. PPHN, or what we call persistent pulmonary hypertension of the newborn, occurs when a newborn circulation system doesn't adapt to breathing outside the womb. In utero, the baby receives oxygen through the umbilical cord, so the lungs need little blood supply. In their lungs, the blood pressure is high, so blood in the pulmonary artery is sent away from the lungs to the other organs through the ductus arteriosus, or what we call the PDA. With PPHN, the baby doesn't change over from fetal to normal newborn circulation. The blood pressure in the lungs is still high, so the blood is forced away from the lungs, which decreases the body's supply of oxygen. Some of the risk factors for PPHN. PPHN can occur in both full-term and near-term infants. It's typically within the first 72 hours after birth. Meconium aspiration, or the fetal bowel movement that's inhaled in the lungs before birth. Birth depression, infection, low body temperatures, congenital disorders that cause underdeveloped lungs, or congenital heart disease also are risk factors for PPHN. Some signs and symptoms: the baby usually is tachypnic, more than 60 breaths per minute. They're tachycardic, they're usually grunting or moaning. They have some retractions, they're cyanotic. Their skin is pale or blotchy. They're cool and blue hands or feet, or acrocyanosis. Low blood O2 levels, even if they're on 100% oxygen. Their blood pressure can be low, decrease urine output. They have some swelling, and they could have a heart murmur. When diagnosing PPHN, imaging and lab tests can help determine if the baby does indeed have PPHN. A chest x-ray determines if the baby has lung disease or an enlarged heart. An echocardiogram, which is an ultrasound of the heart, determines if the newborn has a heart or lung disease and evaluates blood flow in them. Ultrasound of the head to look for bleeding in the brain. ABGs, of course, are looking for how well the baby's oxygenated. CBCs are looking for the number of oxygen-carrying red blood cells, the number of white blood cells for infection or viral, and the amount of platelets. They're also going to look for like a BMP, just to evaluate the balance of minerals in the blood. A lumbar puncture or spinal tap also may be looking for infection or the signs of sepsis. And then, of course, pulse oximetry measures the blood level non-invasively to help monitor the baby's tissues are getting enough oxygen. Treatment. The goal of treatment is to improve oxygen levels in the blood, and also to relax the blood vessels in the lungs and maintain a normal blood pressure. The baby's given oxygen, and medication is kept warm and calm. For oxygen therapy, it's usually 100%, either given via CPAP or a vent. Nitric oxide is also usually given. It's shown to affect or have a good effect on PPHN. It relaxes the contracted lung blood vessels and improves blood flow to the lungs. High frequency oscillatory ventilation is just ventilation. It may improve O2 levels in blood if a conventional ventilator is not working. Medications. Blood pressure medicine can help the blood pressure stay at the right level. Antibiotics if the baby has an infection. Sedation allows the baby to rest and decrease its need for oxygen. And surfactant helps to improve the oxygen intake. For the environment, we want the newborn to stay warm and limit stimulation. So touching, holding, room noise will be controlled. If the baby is really severe, ECMO, or extracorporeal membrane oxygenation, will be considered and may be used. The ECMO delivers O2 to the brain and the body as a temporary support while PPHN resolves. ECMO is similar to the heart and lung bypass machine, which takes over newborn's heart and lung functions with an external pump and oxygenator. Blood is drained from the baby to an artificial lung where oxygen is added and carbon dioxide is removed, then the blood is pumped back into the baby. So it just allows for the lungs to and the heart to take a break and heal, and hopefully the machine does all the work. And let's move on to IVH, or intraventricular hemorrhage of the newborn. So IVH is bleeding into the fluid-filled areas or the ventricles inside the brain. This happens most often in babies that are born early. Causes are infants who are born more than 10 weeks early are at highest risk for IVH. Of course, the smaller or more premature an infant is, the higher risk for IVH. Blood vessels in the brain of premature babies are not fully developed. The blood vessels grow stronger in the last 10 weeks of pregnancy. IVH is more common in preemies that have RDS, or respiratory distress syndrome, also that have unstable blood pressure. IVH typically occurs with the first few days of life and is rarely seen after 1 month of age. And it rarely develops in full-term infants. Who is at risk for IVH? Of course, we said premature babies, low birth weight babies. They tend to be less than 3.5 pounds. Babies with breathing problems, issues that happen during labor and delivery, could have genetic background, shaken babies, head injuries, infection in mom can cause IVH, high blood pressure in the mother as well, and then blood clotting disorders. There are 4 grades to IVH, depending on the amount of bleeding. So grade 1 is the least, and bleeding occurs just in the small area of the ventricles. Grade 2, the bleeding is still inside ventricles, but slightly worse. Grade 3, ventricles are enlarged by the amount of blood in them. And grade 4, the bleeding occurs in the brain tissues around the ventricles. Grades 1 and 2 are most common, and the babies often have no further complications. Grades 3 and 4 are most serious and may result in long-term brain injury. With grade 4, blood clots can form and block the flow of cerebrospinal fluid, and this can lead to increased fluid in the brain, or what we call hydrocephalus. Some of the symptoms, there could be no symptoms at all, but most common or seen with preemies is apnea, blood pressure changes, as well as heart rate or bradycardia, excessive sleep, lethargic, they have a weak suck, they can have seizures or abnormal eye movements, the swelling of the soft spots between fontanelles, so their head becomes enlarged. They can be anemic, and they also can have this high-pitched cry. It's kind of unmistakable if you ever hear it. Some of the tests, all babies born before 30 weeks should have a head ultrasound to screen for IVH. Test is usually done in the first 2 weeks of life. If the baby is born between 30 and 34 weeks, they should also have a head ultrasound done if they have symptoms. Another screening ultrasound may be done around the baby's original due date. The ultrasound also allows to grade the severity of the bleed. Treatments, there's no specific treatment for IVH except to treat the symptoms and the other health problems that can make IVH worse. Also, we support their fluids and their O2 need. Blood transfusions are common to improve blood pressure and blood counts. A baby may need surgery to stabilize their condition, which involves a tube or a shunt placed into the skull to drain the fluid. The surgery is rare because their skulls are very flexible. Complications with the IVH, most likely to happen if they have a grade 3 or grade 4. They can have developmental problems, hydrocephalus, long-term brain injury, and even death. The outlook or the prognosis for these babies, how well the infant does just depends on how premature the baby is and what grade of IVH they have. Less than half of the babies with grade 1 or 2 have long-term problems. Severe bleeding often leads to developmental delay and problems controlling movement. They kind of are jerky. In turn, some of these babies are the cerebral palsy kids that you might see out and about. Some of the ways to prevent it, if you're pregnant and you're at risk for delivering early, having corticosteroids given to you can help reduce the baby's risk for IVH. It also helps the lungs. Women who are on meds that affect bleeding should get vitamin K before delivery. This helps with clotting. Preemies whose umbilical cords are not clamped right away have less risk for IVH, so they try to do delayed cord clamping for multiple reasons at birth. And then preemies who are born in a hospital in a NICU setting and do not have to be transported after birth are at less risk. So those are just a few key points for both of those. Again, I hope everybody's staying safe, doing the best they can, and we hope to see you soon. Thanks.